Holistic care in prostate cancer survivorship. How to talk to patients about side effects. Viewing a sexual health assessment as a necessary part of a holistic health assessment is vital, as sexual health concerns are the most common, distressing, and persistent quality of life issue in patients following cancer treatment. Health professionals may be embarrassed or unsure of how to broach this sensitive topic, and can therefore avoid it altogether. A recent systematic review found 90% of cancer survivors' oncologists infrequently addressed their sexual health concerns, and it is a largely unmet need of cancer survivors. It is important to have a quiet, private area to conduct the consultation. You must obtain consent from the patient, especially prior to discussing matters pertaining to sexual health. Ensure the patient consents to the discussion, and if they have brought someone into the consult room with them, they consent to the other person being there for the discussion, explaining you will be asking personal questions about their sexual health. Reassure the patient the conversation is confidential. A way to overcome discomfort and make the patient feel comfortable is by being honest, acknowledging the potential for embarrassment while reassuring the patient you are asking them questions about their sexual health and urinary function to be able to help them if need be. Be aware of your own sexual script and how this can impact on the consultation. You may assume the patient is not sexually active because of their age or pre-existing comorbidities, or you may be worried the patient will become offended. It is important to leave your assumptions at the door. Each person is an individual and can differ regarding level of sexual activity, sexual orientation, choice and number of partner, type of sexual relationship, and the importance they place on sexual activity. Possible questions to ask for sexual, urinary, and bowel function assessment post-treatment. We have spoken about your general health and well-being. Now I'm going to ask you some personal questions about your sexual, urinary function and health. Is that okay? Prostate cancer treatment can cause problems with your sexual and/or urinary function. Have you experienced any problems since having prostate cancer treatment? How important is sexual function to you, your partner? Were you sexually active prior to having prostate cancer treatment? Are you sexually active now? How important is penetration to you, your partner? Are you taking any medications or using anything to help with getting or maintaining an erection? If so, what are you using and how well is it working for you? Have you had any erections since treatment? What would you rate your erection like out of 10? How much fluid do you drink during the day? Are you doing something in particular when you leak urine? How many pads are you wearing in a day? How often do you go to the toilet to pass urine during the day on average? Do you get up at night to pass urine? If so, how many times on average? What is the stream like when you pass urine into the toilet? Do you have to push to get urine to come out? Is there any blood in the urine or stools? Have you noticed any change to your bowel habits since treatment? Treatment regret. Having a cancer diagnosis can be distressing to both patients and their partners. Both radiotherapy and surgery are equally effective at treating prostate cancer, so it is important patients are aware of all treatment options available to them and the possible side effects before making a treatment decision. Speaking to both radiation oncologists and urologists enables men to discuss each treatment and determine which is most suitable to them, and getting a second opinion can be useful. Evidence shows patients are less likely to regret their treatment decision if they are aware of all available treatment options and the corresponding side effects before undergoing treatment. Mental health and well-being support. Prostate cancer, treatment and side effects can have a negative impact on patients' and partners' psychological well-being. Men are at an increased risk of suicide following prostate cancer diagnosis, so checking how well patients are coping is important during the health assessment. Partners are often more distressed than patients themselves, so it is important to include them in consultations, where appropriate, and provide support. If you feel patients and/or partners are not coping or require additional support, counseling can be of benefit. Prostate cancer support groups provide valuable peer support, enabling men to speak directly with other men who have experienced prostate cancer. There are forums available for men and partners that speak a language other than English, and a support group is available for gay, bi, and transgender men with prostate cancer. Exercise. Exercise is essential to maintain health and well-being. It increases energy, enables a good night's sleep, reduces stress and anxiety, improves concentration, and helps control obesity, hypertension, cholesterol, diabetes, and arthritis. It reduces the risk of heart disease, stroke, and some cancers, and is an important tool in falls prevention and injury. For men diagnosed with prostate cancer or those that have undergone prostate cancer treatment, exercise can have an extremely beneficial impact on their mental and physical health and well-being. This is particularly true for men on androgen deprivation therapy, a common treatment for prostate cancer that depletes the body of testosterone to control tumor progression. Men can experience a number of side effects that can negatively impact on their quality of life, including fatigue, difficulty concentrating, a reduction in bone mineral density and muscle mass, and an increase in body fat percentage. These men can prematurely suffer from frailty, osteoporosis, and sarcopenia as a result of their prostate cancer treatment. A systematic review published in 2012 found grade A evidence that exercise improved muscular endurance, aerobic endurance, overall quality of life, and reduced symptoms of fatigue. The review also found grade B evidence that exercise may improve muscle mass, muscle strength, and functional performance in prostate cancer patients. As clinicians, we play an important role in educating and supporting patients to make healthier lifestyle choices. As it has a positive impact on overall health and quality of life, exercise should be recommended. Exactly how much exercise should men be doing? According to the Australian Physical Activity and Sedentary Behaviour Guidelines, Australians aged between 18 to 64 years of age should be doing 2.5 to 5 hours of moderate intensity physical activity or 75 to 100 minutes of vigorous physical activity each week, and muscle strengthening activities on at least 2 days a week. It can be hard to understand what exactly moderate intensity exercise is, but a way to explain this to patients is to say it is any activity where they can still talk but would not be able to sing. Brisk walking is a great example of a moderate intensity activity, as is swimming or working in the garden. Older adults aged 64 and older should be active most days as much as possible and accumulate at least 30 minutes of moderate physical activity into their daily lives. Physical activities that involve fitness, strength, balance, and flexibility should be incorporated into daily life. Research shows around half of older adults are not getting at least 30 minutes of moderate intensity exercise per day. Meeting the guidelines can seem like an impossible task to achieve, especially for inactive patients. Any physical activity is better than doing none. Suggest they start by doing some exercise and build up gradually to the recommended amount. An easy way to incorporate more activity into daily life is to suggest driving less and walking more each day. Many men with prostate cancer are aged over 60 and may have competing health problems and/or chronic injuries. Exercise physiologists specialize in prescribing exercise to patients with chronic health conditions. By referring your patient to an exercise physiologist, you can ensure your patient is prescribed an exercise program suitable to their level of fitness. How to refer to services for further education support. You can refer to a continence physiotherapist for pelvic floor training and assistance with bladder training pre- and post-treatment. The following link enables you to locate the closest continence physiotherapist convenient to the patient. A team care arrangement can be used to assist with cost of the consultation. Patients can be referred to a private clinical psychologist and may obtain a mental health plan through the GP practice to help subsidize the cost. Often patients are resistive to the idea of seeing a psychologist, so it can be useful to normalize this process and tell them all patients with prostate cancer see a psychologist during or after treatment for additional support. Encourage them to take their partner with them for the session if appropriate. You may also refer couples having difficulty maintaining intimacy to sex therapists. It is important to ensure they have the appropriate qualifications. Accredited psychosexual therapists are registered with the Sexology Association of Australia. If you believe your patient requires urology review, you can refer them to a private urologist or public hospital urology department. Several public and private hospitals have urology or prostate cancer nurses who can provide education and support regarding treatment decisions and managing side effects of prostate cancer treatment, including teaching patients how to use erectile aids. For patients wishing to read further information on prostate cancer, side effects and management, a useful resource is the Prostate Cancer Foundation of Australia. The website also has a support group locator, prostate.org.au.